Hi, once again welcome to Live 360. My name is Robbie Omondi, and today I want to plug you in on a service that each and everyone needs at one point or another in our lives, and I'm talking about healthcare. We are at Premiercare Hospital here in Syokimau, and it is a community hospital. Now, the reason I'm plugging you with a community hospital is because thousands of Kenyans, or rather 80% of Kenyans, have to travel for over 2 hours in search of quality and affordable healthcare. Now, with such hospitals, that doesn't have to happen. And today, allow me to speak to Dr. Stephen Ojwang, who is the CEO of Premiercare, and he will take us through what services they offer and how you can possibly get those services. Come with me.
Thank you. So my name is Dr. Stephen Ojwang. I'm the CEO and founder of Premiercare Hospital Group. So we believe in providing quality, comprehensive healthcare access to the underserved peri-urban communities in East Africa. In 2014, we had our first branch in Kitengela. Our second branch, we've also been to Garissa in 2016. In 2017, we went to Narok. 2018, we went to Loitoktok, and now we are here in 2023. We are here in Syokimau. About 10 years ago, I graduated. I did my radiology specialty training in Aga Khan, and I noticed that we had a lot of clients who would travel very far, some from outside the country, to be able to come and get access to quality healthcare. And it pained me because after graduating, I worked in Nairobi town, and also noticed that there are a lot of clients who have to travel long distances for treatment. In fact, the WHO says over 80% of the population have to travel for over 2 hours to get quality healthcare. So that burden in my heart caused us to try and get the quality care closer to the patient. So we partnered with a few friends, started with Kitengela, because we had a lot of patients coming from Kajiado and even as far as across the border, Tanzania, and wasting a lot of time in traffic and money as well to get to the quality healthcare. So you realize that if you do the math, that is a day that is wasted of productive time, because it's not just the patient who's there, there's also the relative, one or two, who is with them. And if you look at the cost of the loss of man hours, in addition to the amount spent on logistics, sometimes it's even more than what is actually spent on the actual healthcare itself. So we decided, let's fix that. So we were the first diagnostic center in Kajiado County, having set up a diagnostic center with a CT, X-ray, high-end ultrasound, and also lab services, referral lab. So that is really what drives us, to be able to save that patient cost, to save lives, and also save time. There's a lot of cardiovascular disease that we are noticing in the communities that we serve in. While before people thought that cardiovascular disease is a disease of the West, unfortunately it is here with us, especially because of the dietary changes that are there in the society. So we see a lot of strokes, a lot of diabetes, a lot of heart disease, which we gladly handle with the help of our other specialists that we work with. So that has been increasing. But also, more significantly, there are a lot of cancer cases that we get, and they're referred to us especially for staging, to be able to find out for the cancer cases, how far are they and how far have they gone, so that would then inform the mode of treatment, whether it's breast cancer, cervical cancer, or prostate cancer in men. A lot of clients come to us so that we are then able to help them with the diagnosis. And in our outreaches, we are focusing a lot more on the preventive side as well, so that we are not just treating or diagnosing, but we also helping to raise awareness about cancer prevention. So you are right, especially the area where we're in currently. There are a lot of industries, and for sure we've seen a lot of what is referred to as occupational diseases. A lot of people with chest conditions, and unfortunately on the extreme case of it, lung cancer, because some of the pollutants, especially in these areas, along Mombasa Road at the river, some of the pollutants are referred to as carcinogenic or cancer-causing pollutants. So we've seen a slightly high incidence of chest conditions. In addition to that, we're also seeing a lot of cancers in men apart from prostate. There's bladder cancer as well, and cervical cancer in women. So, and that's what we keep encouraging the community to screen for these cases so that we capture them early, but also working with the corporates around who are our key partners to be able to ensure that the staff are protected, they are safe, they wear protective gears, for example, or masks when while at work, so that we reduce this burden of disease that is within the region. Yeah, so you've raised a very important issue, because approximately $6 billion is spent annually from the East African region to seek care in outside the country, especially in India. So you can imagine that's quite a lot of resource. If it was deployed locally, then it will save a lot of cost for the people who are spending a lot of money on logistics to be able to access that service outside the country. So we are quite keen on that. Our location here on Mombasa Road is very strategic. We believe that will create a center of excellence that is accessible not just by road, but also because we are next to the airport. We should provide that regional hub whereby people can come in and be able to get that high-end treatment like they can get anywhere in the world. And we have a team of specialists that we are working with very closely to be able to bridge that gap. And that is for sure the purpose for which we believe Premiercare is called to do. If you look at the healthcare system right now, one of the biggest costs where people spend have a lot of pain is the time it takes to get quality healthcare, especially because a lot of time is wasted in terms of accessing different levels of care. So I'll go to the doctor and I'll be told, okay, here we've talked to you and we think you need an X-ray or a CT scan, for example. So we send you to another facility. At that diagnostic center, some patients even walk in there directly, and then they're told you need to see a physician or another consultant in a different hospital. So they move to the third hospital. By the time someone is getting the actual treatment, they might even walk with that prescription from the big main hospital. But because it's too expensive there, they'll come back to the local pharmacy where they are to buy that medicine. So if you look at the time and the resources taken to move across the entire journey, it is very costly. And some people even lose their lives in the process, moving around from one hospital to the other. So what Premiercare provides is a one-stop shop solution that is comprehensive and captures the entire spectrum, right from the diagnostic care to the inpatient hospital care, but also more importantly, the primary healthcare level, the community pharmacies, which are a point of the biggest impact, because the statistics show that about 70% of the population, the first point of care that they go to is the local pharmacy. So how then are we able to partner with the pharmacies within our units, or even the local pharmacies around us, to provide that quality healthcare? So Premiercare offers a one-stop shop that saves lives, but also saves time and money. I hear you. So unlike what many people would expect, our consultation fee is only $500. And because we believe that that initial contact with the patient should be as wide as possible, so that we do not deny access to service to clients who need our help. So the purpose for which it was set at that is so that we allow as many people as possible to be able to access quality, because everyone deserves quality care, irrespective of their socioeconomic status. So that will allow us to screen and then be able to decide, okay, what next test do they need? If it's a lab test, if it's an investigative a diagnostic procedure like endoscopy, for example, or do they need further specialized tests like CT scan, or do they need to see a specialist? We have a lot of specialists within the region. Some of them even work away from here. So we are saying, instead of the client traveling all the way to the main city, why can't we assist them and save them that time? Yeah, so I would encourage the clients who would want to seek services to not to be intimidated, not to fear, to come, and we are ready and we are here to serve them. That's why we're here. So that is a very intimate question that you've raised, and it's something that is very close to our hearts, because the motherhood journey, most of the a good number of times, begins with us, because they come routinely to get their ultrasound scans or to get their antenatal checkups. So we walk the journey with the mothers, we encourage them, we advise them on what care to take to be able to make sure that there is safety for the baby, both before and after delivery. And we work closely with our specialists, the gynecologists, in all our branches, because maternal care is very important. And we believe that no mother should die in the process of delivery or of giving life. So it's very close to our hearts. And in one of our facilities in Narok, we actually have an inpatient facility that is tailor-made specifically to ensure that there is optimal mother and child care, so that the whole journey, even till delivery and even beyond delivery, is optimized. And in addition to that, we also have postnatal services, and we follow up these children and their mothers to make sure that they are healthy. And not only that, even those who are not able to come to hospital, we have a lot of community outreaches just to be able to sensitize them wherever they are, because knowledge is power. If you look at a county like Kajiado, for example, approximately 40% of the deliveries occur outside hospital facilities. Yet, the government, for example, has provided access to free maternal care. So there's a big gap there. So much as we are attending to the clients who come to our facilities, we also have an obligation for advocacy. And we do a lot of community outreaches just to sensitize people on why safe motherhood is important. So it's something that's close to our hearts, and we are just beginning the journey to just even make this move to the next level right here in Syokimau, and even beyond to other regions of the country and the region. So while some people think we've made a few steps, we believe we are just getting started, because the burden is out there, it's big, there's a lot of work to do. And if 80% of the population still have to travel for more than 2 hours within the region, surely there's a lot of work that still needs to be done to provide access to that quality health care, especially within the peri-urban settings where more than 80% of the people live. So we have a lot of work to do, and we are looking forward to this journey.
So you've heard from the horse's mouth, and I've plugged you with one of the services that we all need at one point in our lives. And you've heard from Dr. Stephen Ojwang. The consultation fee for Premier Healthcare Services is only 500 Kenya shillings. Feel free to visit not only in Syokimau or Kitengela, but in different outlets in different parts of the country that Dr. Ojwang has mentioned. I'll also put them down below, including their contacts. Give them a call, and don't forget, healthcare is very important, and when you have access to easily affordable and quality healthcare, then your life will definitely be better. Until next time, this is Life 360, and my name is Robbie Omondi. Bye-bye.